Just imagine you went for regular physical and a blood drawn, and next day your doctor's office is looking for you. And they want you to come to the office so that doctor could talk to you and give you your results. You're shocked, you're worried, and you go and see your doctor and he tells you that your blood sugar is high and your hemoglobin A1C is more than 6.5. Suddenly you feel your life is changed upside down. You do not know what to do, and only thing you know that your life will be full of restrictions, lot of medications. You're shocked, angry. Why this thing happened? What can you do about that? And my job in this video is to progress you through stages of grief or stages of chronic medical problems. Anybody who is ever diagnosed with chronic medical problem go through these stages. First is denial that I don't have it. There is something wrong with the blood test. Could we repeat it? Then they become angry, bargaining, and then eventually reality starts settling in. You want to make the changes. My goal is to guide you through all the long-term mindset changes you must bring so that you understand the complications and you prevent them. If you get the complications, we both failed. In this video, I'm going to take you through the journey from initial shock through all the stages and different questions you will have. After your initial shock and anger and denial, then reality starts settling in. First question every diabetic asks me is, what is diabetes? Diabetes is a condition where hormone insulin either is deficient or your body is not able to produce enough insulin to meet glucose load which you eat, and your blood sugar start going up. I said two things. Either your body is not producing enough insulin, or whatever insulin is producing due to increased demand, it is not enough. That is what we call insulin resistance. Insulin resistance plays a major role in the pathogenesis or development of diabetes mellitus. Every time you consume carbohydrate load, your body produces insulin. And if your food is predominantly carbohydrate and especially simple carbohydrates, you are exposing your body continuously with very high levels of carbohydrates. And these high carbohydrates make your cells toxic to sugar. Physiologically, every time you consume carbohydrate, insulin is secreted. Insulin is like a key which goes to all these cells and open the gates so that your glucose can get into the cells so that it could be used for energy. But if you are bombarding your cells with very high insulin, the key stops working, the locks are permanently shut, and you develop glucose tolerance and your sugar start coming up. High blood sugar give you two kind of complications. Acute complications just by the fact that how high your blood sugar is, and chronic complications based on all the micro and macrovascular changes it brings in the body. Macrovascular changes include heart attack, stroke, PAD. Microvascular or small vessel changes include losing vision, losing kidneys. Skin changes, diabetic neuropathy. So first question which you will invariably ask me is, what is diabetes mellitus? Then your questions shift and you start bargaining. Can you reverse it? Technically the answer is yes, if you are disciplined and you could change your life forever. You could reverse it, but only 5 to 7% of the people who get diagnosed with diabetes can make permanent life-changing decisions. So statistically, odds are against you, but you could change it. What it will involve, we are going to discuss as we go along. Next question always is, how many medications I have to take? Do I need insulin? Not every type 2 diabetic needs insulin. We could do a lot with lifestyle and different classes of medication. It was very astonishing to know in my personal aspect during initial conversation with the patient when they ask this question. This really amazes me all the time. And the question is, can I drink? I did a lot of literature research and I found this question is being asked all the time. Diabetes doesn't curse you for everything, but yes, you could drink, but not more than 1 drink a day. I will explain as we go along, but that should not be on the mind. But I just wanted to share because if it was my experience and literature research shows this is the question which is being asked, I will answer that question scientifically. You should not consume more than 30 ml of hard liquor or 1 glass of wine or 1 can of beer if you have a diagnosis of diabetes, because beyond that your liver cannot process it. Once you are gone through your initial shock, then a real emotional journey starts. And these are the questions you ask. Do I need to take insulin? Not everybody needs insulin. It will depend on your hemoglobin A1C. That is the test which gives you an idea how high your sugar over the period of last 3 to 4 months is. Did I do something wrong to get diabetes mellitus? Yes, your lifestyle is responsible for that, but in very few cases, genetics, medications, and other things can contribute, but primarily it's lifestyle choices which we have made. What are the side effects of different medications? I'm building up a story and I'm going to take you different classes of diabetes mellitus. How much it will cost? Diabetes is a very expensive disease. It is estimated that it costs but 2.3 times more than normal if you have diabetes mellitus. Just on the diabetes, it is the 8th leading cause of death in the United States and worldwide, and also it is very expensive disease. I am worried that what will people will think about me. I don't think in our society these days anybody has any kind of stigma related to diabetes. You'll be shocked to know that in the United States, there are 37 million people who are living with diabetes. 7 million of them even do not know they have it. And 96 million Americans out of 300 have pre-diabetes, meaning they don't meet the legal definition of diabetes mellitus. This is a good point to discuss how your doctor decides whether you're diabetic or not. Diabetes could be diagnosed with primarily following criteria. Number 1 is the hemoglobin A1C. That is, in my opinion, the best test. On your blood test, doctor, if your hemoglobin A1C is more than 6.5, you're clearly diabetic. Between 5.7 to 6.4, pre-diabetes. That's where 96 million people live in the United States. And if you're less than 5.7, you are normal. So first criteria is hemoglobin A1C. Second criteria is random blood sugar. If your blood sugar is checked randomly and your blood sugar is less than 180 within 2 hours of eating, you have pre-diabetes. And if it is more than 180, you potentially have type 2 diabetes mellitus. Third test is glucose tolerance test. It is similar to eating, where we give you load of glucose and we check your sugar. And again, same numbers hold. If your blood sugar at 2 hours is more than 200, you have type 2 diabetes mellitus. If it's less than 200, possibly you have type 2 diabetes. And if it stays less than 140, you are normal. Then, as you know, you prick here and you check your fasting sugars. If your fasting sugar is consistently more than 126, you are diabetic. And if it's lower than 126 to 100, that is pre-diabetes, and less than 100, you are normal. So I don't think anybody has a leg to stigmatize to you, because a lot of people have it. Will losing weight will help me manage diabetes mellitus? Absolutely. Weight loss is the key. If you lose 7% of your weight, you will reverse type 2 diabetes mellitus and prevent all the complications up to 58%. Just imagine you are 200 pounds and you lose 14 pounds. You pretty much not only reversing your glucose resistance, you are reversing type 2 diabetes mellitus. This question comes a lot, whether I have to take the medications for the rest of my life. It depends on you, as I mentioned before. If you change your lifestyle for good, you adopt healthy habits, you can stop the medications. But we are a victim of our mind and vices. If you are not going to change, you will be stuck with the medication and probably more. This is a good time to discuss diabetic medications. Let's take the journey of food in your body. Primarily, food is made up of 3 macronutrients: proteins, carbohydrates, fats. Other constituents of food are vitamins, minerals, and water, and fiber. All the foods exist in different permutation and combination, different percentages of macronutrients and micronutrients. When we talk about processed foods, what we are referring to primarily is fiber content. When we modify the food from its natural, the way nature intended to be consumed, and most of the time what we do is we remove fiber, we make it processed. And depending on how much fiber we are removing, processed to ultra processed food. Like a donut is ultra processed, and to make it worse, we add sugar to it. Soda pop, any kind of liquid calories, is a death sentence. In this, you are consuming empty calories and you're bombarding your system and leading to glucose resistance or insulin resistance. So today we are talking about carbohydrates out of all 7 of them. Carbohydrates, when they get into your gut, they are broken down into glucose. From there, they are absorbed and they are taken to the liver, where liver converts into glycogen. That is the one which gets stored in your liver and keep you going, your bodily machinery going when you don't eat. Then rest of the glucose is pushed into circulation where it's taken up by the body. So potential places where diabetic medication can work is either start with eating what we eat. Number 2, we have a class of medication which stops absorption of carbohydrates from your gut. Then in the liver, we have a medication which is metformin, which stops the production of or conversion of your proteins into glucose and through other different mechanisms. Then the medications, including insulin, DPP-4 inhibitors, GLPs, they all will work on one mechanism or the other. Either they are leading to increased secretion of insulin, or they are making your endogenous insulin work better so that you could absorb insulin and you could take care of yourself so that you could lower your sugar. Then there is another class of medication which is we call SGLT2 inhibitors. This class of medication makes your kidneys dump excessive sugar into the urine and you lower your blood sugar. So this is through this journey, whether going from eating to stopping absorption in the gut, then in the liver, then making your insulin, either making your body to produce more insulin or make it work better. then eventually using medication to dump excessive sugar into urine. Exercise, the way it works is that once you work, those lock and keys, like where insulin is not opening up, those doors, exercise makes those locks open. It's like a sponge which pushes excessive glucose into your cell to burn as an energy. So this is how different classes of medications in diabetes work, but we're going to take up individually as we go along. Next question, which is I have partly answered. Can I go in remission or is long term? It depends on you. If you can change yourself, you could reverse it. Can I have healthy pregnancy if I have type 2 diabetes mellitus? Absolutely. Diabetes is not a curse. Millions of people have beautiful pregnancies without any complications, so long as they understand and they take care of themselves. Is diabetes a death sentence or can I lead to a normal life? Absolutely, you could have a beautiful life. You can live life without any complications, without any problems. You have to get yourself educated. You have to take care of yourself, prevent complications, and take the medications as prescribed. What are the complications of diabetes mellitus? Diabetes will give you complications acutely when the sugar level is very high. You might have heard a condition, diabetic ketoacidosis, if the sugar is too high and your body cannot use carbohydrates and it start using your fats. You start producing a lot of acid and go to ketoacidosis. Otherwise, high blood sugar, you are too sweet, the bugs like it, and you will have repeated infections and complications. But the things which we dread are when they start affecting our blood vessels. And depending on the size of the blood vessels which are affected, if it affects medium-sized arteries like in the heart, brain, and leg, we get heart attack, stroke, and PAD. 21% of the patients who have heart problems have diabetes mellitus. Further, smaller blood vessels, when they get involved, we start getting blindness, kidney failure, peripheropathy, which manifests numbness, tingliness, burning, or sensations in your extremities. This question comes a lot, whether I am going to go blind or lose my foot. Nobody should have these complications if they are honest in taking care of themselves. But unfortunately, people want pill or a procedure to change and they don't want to change themselves. If you are one of them, you will have a complication. What is the role of supplements like apple cider vinegar, cinnamon, berberine? There is no evidence that these supplements have ever been tested, but people swear by that. If in addition to your medical treatment and lifestyle changes you want to add it, you may get some benefit, but it is not something you could rely on. Can I do intermittent or religious fasting safely with the medication? Generally, I will say yes, but you should talk to your physician based on what medication you are on. What about sexual health? If you let your sugar high, males will lose erection and the ladies will have repeated infections, and having diabetes alone can lead to loss of desire to be intimate. What is the role of checking blood sugar at home? This is a question which comes over and over. If you do not get feedback on your habits, like when you eat, how your body responds and how high your sugar goes up, we all not created equal. We all have different responses. These days, we have continuous glucose meters. It's like a small dot, you put it on your arm. It records your sugar on 24-hour basis. And you get the feedback immediately based on what you are eating, what you're doing. And I have seen my patients who are able to afford or the insurance covers continuous glucose meter. they are lowering their blood sugar significantly to the point of almost 1 to 2 grams percent based on feedback. You see, up till now, all the questions I've been asked by patients and through my research is involving around superficial, nothing getting deeper into to change themselves. Now start the real questions which people ask. What can I eat, and do I need to cut out all sugars and carbohydrates? Now is the real question. These days, there is a universal way we teach people how they should eat, and it is called plate method. Imagine a plate, half of it is filled with vegetables. 1/4 of it is your protein, and 1/4 of it is complex carbohydrates, whether it's rice, legume. But goal here is this quarter is a complex carbohydrates. You are not doomed that you cannot eat carbohydrates. You just have to change from simple carbohydrate to complex carbohydrates. In this podcast series, we will be going over each question. Probably we will explore in separate episodes, but this is a flavor of what's coming up. Next question comes in is, what should my sugar be? Remember, the definition of diabetes is more than 126 fasting consistently. So that's what we are trying to achieve. But the accepted standard is 140. If you keep your sugar less than 140, your hemoglobin A1C will be around 7. And that is the first target. Lower the better, but we want every diabetic to have hemoglobin A1C less than 7. Next question comes in is, if I get sick, what do I do? During sickness, depending on what kind, either the insulin requirement will increase or decrease. That's a very close relationship with your doctor, especially your primary care, is very, very important. General wisdom is, if so long as you're eating, you're not throwing up or you're having a diarrhea, you should continue the same dose of medication. But that's one question which I want to defer to your physician. A lot of questions usually have been asked regarding hypoglycemia. People are very worried about hypoglycemia, and very rightly, because low sugar has a lot of implications quickly. So we take hypoglycemia very closely, and we want to make sure you are taken care of properly. Anytime you have hypoglycemic episode, to take care of hypoglycemic episode, you need to think proactively. You must have access to simple carbohydrates like candies or sugar tablets or injection of glucagon. Fortunately, the medication which are notoriously were linked to hypoglycemic episode was sulfonylureas, and we are very rarely using that class of medication unless that's the only thing you could afford or that's the only thing your insurance covers. Newer medications are very safe. They do not lower your sugar unless they are high, but sulfonylurea and the insulin still will remain very high on the list, and you want to make sure if you're taking insulin or sulfonylurea, stay on guard regarding hypoglycemic episodes. At what level of sugar I should go to the emergency room? I think before you go to emergency room, you should always try to reach your physician if you do not have symptoms. If you are feeling weak, dizzy, fainting, difficulty in breathing, and these could be the signs of being in a very high sugar and diabetic ketoacidosis, or you're sweating, your blood sugar is low, and you're having hypoglycemic episode. Whenever in doubt, call 911. And if you don't have symptoms and you're concerned, you should call your physician and get some early appointment or advice, because your physician knows you the most. Once you know general superficial questions, then you start asking some management questions. Now comes the long-term mindset. This is where the real discussion happens. Every diabetic on an average should see a physician 3 to 4 months. Have hemoglobin A1C drawn. That's the test which gives you average blood sugar. Minimum every 6 months. Every diabetic should check blood pressure, cholesterol on a regular basis. And the goals for the diabetic regarding blood pressure, cholesterol are different than general public. Every diabetic should see eye doctor once a year. They should have their foot examined every visit, and they should self-inspect their feet for any kind of cuts, bruises, ulcers on daily basis. And above all, you should let your doctor know any kind of complications or questions which you may have. We do get a lot of questions when should I we do get this question all the time, when should I be tested to rule out heart problems? In an asymptomatic patient, according to United States Preventive Task Force, there is no evidence exists that you should have a preemptively some test done. But if you do have these symptoms, because every diabetic is at high risk for developing coronary artery disease, they must let your physician know, and they will plan your preventive testing appropriately. Every diabetic should get age-appropriate preventive care, because diabetes will put you at high risk for complications, especially infectious complications. The regular flu shot, pneumonia shot, COVID-19, Hep B, tetanus, you should get yourself updated. You must let your family know about your diagnosis. These days with smartphones, ensure that you keep your list updated, which is easily accessible, which should include your allergies, doctor's phone numbers, and be wise in picking up your doctor. You should pick for physicians who have open schedule so that your needs are met wherever you are. If you are in a practice who are very tight with their schedule and they don't offer same-day appointment, you will have worse outcome than open practice. With this framework which I wanted to take you through was when people get diagnosis of diabetes and then they have very severe emotional response. People equate this disease with restrictions and change in life. And that is a true statement. The life changes, but with proper guidance, lifestyle changes, proper medications, evidence-based treatment, and preventive treatment to rule out eye problem, kidney problem, nerve problem, and then if you have symptom, looking for major artery tests. If you get those things done, absolutely there is no reason you cannot live a full quality full life. I want to end this podcast with the message that pure, good, long life is possible with diabetes. We will be creating a lot of video series. We will be creating a lot of podcast series on diabetes mellitus. And we want to take a different approach where we answer your questions properly. In next podcast, I will be discussing with you in detail about lifestyle. Stay tuned. My name is Kundlas and I'm a primary care physician. And like, share and subscribe to our channel Kundlas MD. I will see you in next podcast. Thank you.